And yes, hello everybody. This is Vandana Joshil once again, and this time I'm not with Saath Ki Baat, Lajja ke Saath, but I'm doing a special interview in considering all the chaos that's happening and all the fear that the coronavirus pandemic is suddenly causing in everybody's lives. What we at Lajja realized that there were a lot of pregnant women out there who were suddenly very paranoid. Pregnancy by itself takes a toll on your mental, emotional, physical health by itself. So when you have something like a pandemic come in during your 9 months of pregnancy, it's just definitely going to cause havoc in your minds. So to bring some more information to you, pregnant women, and to put your hearts and your minds at ease, we have two wonderful doctors with us. We have Dr. Shilpa Saple, who is a
Hello.
senior fertility consultant with the Surya Fertility Clinics in Santa Cruz. She is an MD. She is a DGO diploma in gynec endoscopy. She is a master of reproductive medicine and IVF from the UK. She is an MD from the Grant Medical College and JJ Group of Hospitals. She is trained in IVF from the Homerton University, UK. I hope I got that right, Dr. Shilpa.
Yeah,
She's
you
been
can say
practicing.
fine.
She's been practicing fertility. She's a practicing fertility expert for the last 16 years and is fertility and endoscopy for gynacs. She has published several papers in international journals and has been awarded the Wonder Fogsian, that is FOGSIAN award in
Yeah,
2019 for her contribution to women's health. So thank you, Dr. Shilpa, for joining us. We
yeah.
now
Thank you
go
so
on
much
to
for
Dr.
the intro.
Kalpa. She Yes, Dr. Kalpa is the founder of Healing Tree Clinic. She is the chief counselor at the Sanskar Shakti Garva Sanskar Kendra. She is a homeopath. She is a chakra healer and a Garba Sanskar counselor. She also her skills include hypnotherapy, chakra healing, access bar, neuro linguistic programming, and most importantly, she is a Lajja ambassador. So it's so much pride that we have such skilled and such trained gems as part of the Lajja team. And I'm sure that every one of us is doing something or the other and adding so much value to the team. So without wasting any further time, I will jump right into the questions. And Dr. Shilpa, my first question goes to you. How worried should pregnant women be right now?
So, regarding the coronavirus scare, as we know that this disease it's very infectious, and although it is a flu, but because its source is from a pathogen which was not linked to the humans initially, so we don't have immunity against it. And in pregnancy, the immunity is still low. So pregnancy is an
True.
immunocompromised state. So yes, in pregnancy, we are worried if you get this infection. And overall, we know that we don't want this pandemic to become an epidemic state. But in pregnant patients, yes, we should be worried and take proper precautions to avoid getting infected.
Okay. So, Dr. Kalpa, what do you think are the basic precautions that pregnant women need to be, following right now?
So there is enough material all around telling people what they need to do. So like yes, basic things is they have to, the first and foremost thing, every time that they are stepping in the house from outside, they need to wash their hands. Need not be sanitizer or something, but just wash your hands. Maintain as much as less amount of contact with people around and outside the house. Social distancing in true sense. Don't visit relatives, don't call relatives and friends at your place just because it's a holiday. So even they are not, they don't have a history of traveling, but you don't know whom they have met, where they have gone, what they have done, just to minimize the chances of
True.
the infection. And why just corona? Any infection, pregnancy is a state where you want to protect yourself and the baby the most. So keep yourself safe from any infection as you are doing it.
True.
Yeah,
Okay,
particularly, I want
okay,
to add
true.
that even
But yes, Shilpa.
hello, yeah. So I want to add that even now, yeah, the people whom we come in contact with, that is your milkman or the newspaper wala, these people are also visiting your house. So you have to take precaution of getting infected. So uh, social distancing from people who are coming from outside is also one of the essentials which you should take when you're pregnant.
So Vandana,
Okay. So
there's one more suggestion that we can
yes,
have is generally we tend to use our dominant hand to clean our eyes, nose, or face. So maybe they can take up this activity
yes,
with the non-dominant hand. So if they are right-handed, maybe they can pick up the milk bags from the left hand, or open the doors with the left hand, or open the knobs with the left hand, just minimizing using the same hand going to the face. It would be little difficult to wash every time you touch everything else apart from your body, but at least just if they can just discriminate while doing all the other activities, being a little cautious and using your non-dominant hand, and using face for your, I mean, and touch your face only if it is required.
actually, that's quite a challenge because what I've noticed is ever since this thing of don't touch your face, I'm so conscious that every time even my hand goes like this, I'm like, "Arey baap re, muh pe haath laga diya." So maybe we were already touching our faces without realizing it, but now we are like overly conscious, and so it becomes an even bigger challenge. But yes,
Mhm.
I think that was a very interesting and an insightful tip, Dr. Kalpa. So in this case, we talk about self isolation. We are telling people to isolate themselves. But
Hmm.
for a pregnant woman, chalo, she has that leeway that you can tell people कि अरे वो pregnant है इसलिए वो अलग बैठी है या अलग कमरे में बैठी है.
Mhm.
But how much is really required and how much is possible? Dr. Shilpa, I will ask you this question.
Yeah. So I feel self-isolation only if the person is having a problem, like if the person is having any infection, then they can practice self-isolation. Or if there is some known contact who is in their house or very close contact who has had the history of exposure. Otherwise, it really depends on what situation the lady is. So supposing she has a family wherein people around are not going out too much, or wherein the husband comes, he takes adequate precautions and cleanses before he comes inside and touches the
True.
things. It's
Hmm.
not required for the female to isolate herself totally, because in pregnancy, in the mental state also has to be catered of the pregnant woman. So as it is
Exactly.
anxiety about what's going to happen to her, to the baby, and leaving her out on her own without anything to do is something even more worrisome. So self isolation, I would not recommend for one and all. It is only for the person who has any infection, or a person who is having a very high risk of coming in contact with someone who has infection.
I'm so glad that you brought in that mental health also into it, because that was one of my questions. What self isolation? This is the time when a woman is so, she thinks her body is going through so much. There are so many hormonal changes, and suddenly you are like side pe baith jao and nobody's going to touch you or come near you. That's going to be very stressful. Kalpa, what would you add a little bit to that?
So basically, as a family, let everybody take this as a rule, not just because she is pregnant, usko alag kar diya, yeah, because she is pregnant, she is supposed to be isolated. No, as a family, it's the instructions are same for everybody. Let's not go and mingle with too many people. So that much of isolation is sufficient. You know where your family is, what they are
Okay.
doing, so that is enough. So it's not something that has been like done specially, or like a pregnant woman is being punished to be in that state. No,
Mm.
everybody is generally observing care so that we don't mingle with too many people and get the chances of being infected. So sometimes you are mentally happy. अरे
True,
सब कर रहे हैं
true.
तो मुझे करने में क्या problem है?
Mm.
So if everybody makes it a rule, let's
हाँ.
stay at home. Not just because तू pregnant है, तू घर पे रहे, हम बाहर जा सकते हैं. वैसा नहीं. Let's make it as a rule for everybody in the house. Avoid unnecessarily outings. Avoid stepping out for unnecessary things. So that will be general. It's all right.
Now, Dr. Shilpa, there's been this general rule that try and avoid going to, hospitals, so that you try and stay
Mm.
as far away from
Yeah.
a possible infection.
Mm.
But what if
Yeah.
a woman is due for her checkup during this time? Uh, is she allowed to go out, or what does she have to do if she has to go for her appointment? Are doctors taking appointments? That is the first thing.
Right. So for it really depends on what stage of pregnancy is and what the checkup is for. We generally schedule antenatal appointments every 2 or 3 weeks, sometimes even after a month,
Yeah.
if in between there is no issue. But there are some critical stages
Yes.
like a 12-week scan or a fifth month scan, a checkup, and sonography, which you can't afford to miss. As such, if you go to the hospital with due precautions, in the hospital also you have to take care of yourself, like maintaining a distance in places, and taking adequate protection of yourself, having a mask or if required at that time, and avoid touching of tabletops or any other counters where unnecessarily generally when patient is waiting they tend to lean on or happen to touch these places, which is not really necessary. Plus, first and foremost, you should call up your doctor whether I have an appointment at this time. And generally, when we as obstetricians have records of the patient, antenatal cards, so we know that this is this week of gestation. Our patient can always tell, "Okay, it's my this month, and I need to. You've called me at this time." So at that time, the doctor can judge if that particular visit is required right now, or it can be deferred after 2 weeks. So that is the first thing. If pregnant patient has any complaints like headache, vomiting, or fever, or any other complaints, which may not be your viral means not related to any viral infection, but certain swelling or any other thing which she has not had till
Mm.
now, then she should see the doctor that it's not for a routine visit, but I have these problems. So let the doctor see and advise accordingly. So yes, for routine
Okay.
checkups, we are not calling, but then those patients who are due at particular time or those who have complaints, those we are trying to see them and advise them accordingly.
So Vandana, I see
Okay.
there is one
Dr.
problem of
Kripa,
lately.
yeah.
So what happens if somebody has a cold also, they are scared to go out because the minute they sneeze, cough, or
Mhm.
they have a running nose, they are scared. So don't be scared of
Yes.
telling your complaints. Every sneeze,
Mm.
cold, and running nose doesn't mean that you
Is
have
not.
corona.
Mm.
So please be careful. If you have something like that, just mention it to your doctor while you're making an appointment. However, it's a regular visit, but just tell them that I'm suffering from little cold.
Mm.
So maybe the doctor also can schedule appointment in such a way that people don't treat you with scare, and you are taken care of.
Yeah. True, true. And would it be advisable for women if they have to go for their checkup to wear gloves and mask? Of course, everybody's wearing a mask now. It's become like a fashion statement. But what about gloves? You recommend that they also wear gloves and uh,
So Vandana, it's not about gloves or mask. The way they wear it, no, it's all spoiling it. So if I wear a mask
Mm.
and I'm constantly touching my mask with my hands, what good am I doing? So mask is to prevent me from
true.
touching my, yeah, and they will put the mask down, they'll rub the mouth, and
Right.
then they'll put the mask up.
Put it back.
So they need to understand simple things that they have to avoid touching their eyes, nose, mouth, ears. So whether you wear a mask or you don't wear a mask, if this much discipline is maintained, it is enough. So even if they wear a glove, doesn't mean they'll remove the glove and touch themselves. So if they're going to do that, these instruments are only to add on, not to be used just as a checklist sake, and then you are just doing no good because you are wearing the gloves and touching everywhere.
No, the reason for asking this question is because Dr. Shilpa said, try and avoid leaning on things and touching things. Now, but generally, when you look at a pregnant woman, you see her leaning on,
That's true.
railings to get support, and that is where I thought, in such cases, glove is necessary. But yes, point.
Yeah.
It's absolutely useless if you're still going to keep touching yourself.
Yeah,
So
you may wear a glove,
yeah.
but then remove and touch
Now, what
yourself.
about?
Hmm.
Okay, okay. Yeah. So, Dr. Shilpa, what about if a lady is due for I had a lot of women calling me up and asking me when they knew that we were doing this session कि हमको तो ये हफ्ते में ही हमारी डिलीवरी डेट है और अभी अचानक से हो जाएगा तो क्या बच्चे को भी प्रॉब्लम होएगा बच्चे को कोरोना वायरस आ जाएगा क्या now I don't know how you can't blame them because they are scared it's rightfully their right to be scared at this time but can you tell us a little bit more at risk is the baby at risk if it's delivered
So,
during this time?
whatever cases have taken place in China, they have analyzed those patients who had come for delivery and the people who have contracted, means already the mothers were having viral infections. So, in that, they have not found
Hmm.
any additional risk or it being passed to the baby, either in amniotic fluid or
Okay.
the baby didn't suffer from any viral symptoms or anything, nor was it present in the breast milk. So, even if the patient of the mother has the viral
Great.
infection and she delivers, there is no issue. Regarding a mother who is absolutely asymptomatic, there is no need to worry because, I mean, who doesn't have any infection, just going there and delivering doesn't mean that she will catch the infection. There is no need to worry. And this patient should follow up routinely as she was, because later part of the pregnancy is very crucial and whenever she gets pain or anything you just have to draft out what things you require, keep them ready, and when the time comes, yes, as she would normally go, she is to just take precautions and go.
Okay, Dr. Kalpa. Okay, now women have. If when a woman goes into labor and she goes to hospital and she delivers, is hospital stay advisable or should she get out of the hospital as soon as possible? Now, these are questions that people have asked me, which is why I'm asking you. Sometimes they seem very lame, but I know that there are a lot of worried women out there.
Correct. So I think
So
Dr.
yes, Dr.
Shilpa will
Kalpa.
be in a better position to answer this because sometimes there are some gynec indications for which you need to stay longer. Otherwise, if there are no indications,
Okay.
I don't see any reasons to withhold them from staying there. But what I think, which is in our hand as audience or as pregnant mothers, first is don't announce this birth to your relatives around. Avoid them coming and visiting you and your child, and I mean try and restrict. I mean if you don't announce, they would not know that you have delivered and they have to come and see you. So just keep this news to
True.
yourself. You can very well announce after some time when the child has also become of a little substantial weight, you have come out well out of your labor process and the post labor care that you need to be taking. So I think this is something which is in your hand. If your gynec foresees some conditions, they will withhold you, but they will not. I mean there is no option of, they would not like to keep you longer just because they want to. So if they see you are fit and fine, if you have normally delivered, I think on third day you are discharged. And in cesarean for operative complications,
Okay.
you are discharged on fifth day. So you can't rush into getting delivered early as well. But what you can take care is avoid calling your relatives because you've delivered and showing your baby to everybody, posting on social media so that people come and wish you. So in India, people don't ask you before coming; they just come in because you've posted that we've delivered. So either you withhold the news because then you can't call them. मैंने बताया आपको मगर आप नहीं आना. That you can't do. So stay, keep the news to yourself, enjoy it for yourself, and then when you are fit and fine, have a celebration. Call all people at that time when India is corona free.
Oh, I can
So,
imagine the hangama that's going to happen. बच्चा हो गया बताया ही नहीं. My God, we are setting a trend over here.
yes, so
Now,
just to add on that, that patients should
yeah,
not feel that hospital is the source of infection
Hmm.
or that is the place wherein they will get it. In fact, it is the otherwise, and you should feel absolutely safe at the facility where you're going. And even there, the doctors, everybody who's attending, like if I'm treating a labor delivery patient, generally we are not the ones who are treating respiratory infection patients. And even if we, so it's not like it's not that easy that people are getting it. Plus, confirmed cases means, or those even who are suspected, there is a strategy in which they are directly referred to a center, that is in Mumbai, the Kasturba Hospital. And from there on, there are nursing homes or hospitals who have special wards for it. So you don't have coronavirus just in your neighborhood hospital and a doctor treating it. It's not like that. So be assured that hospitals are safe places, and you go over there whatever time doctor is foreseeing for the labor delivery part to settle and for you to recover, for the baby to recover. Times baby has some issues and is to be kept in the NICU, everything. So that doesn't mean that you are at a high risk of having this infection. So just be well assured.
Okay. A question that's just popped in my head is for Dr. Shilpa. You are an IVF specialist. So, are you doing these procedures in this current time, or have you put them off? Or because I understand IVF has a cycle. You have to follow a cycle. So, are you still seeing patients? Are they allowed to come in and do their procedures, or have you put that also on hold? How is it working?
So, so majorly we are not doing any new stimulations or any new cycles, but the ones which are already going on and they are in their last stage of having an egg collected or embryo preparation. So those we have to counsel the patient, and if the patient wishes to go ahead because the risk and they don't have any contacts or they are low risk patients, we are going ahead doing the procedure and freezing the embryo. We would not want to do an embryo transfer. That means putting the baby back into the uterus. And by and large, we have stopped doing that. But of course, everything is discussed with the patient, and they are made aware of what the thing is. Even our guideline, which the governing body for the Obstetrician Gynec Association, even they have put up this guideline. You have to give the patient a choice and accordingly defer the procedures. But yes, we are not doing starting with any new cycles. Any treatment
New
cycle, because
ones.
it
Oh.
starts from the time of patient's menses. So whatever we have started,
Hmm.
like those things, it's difficult to just put a full stop on that. And it's not a one day
True.
thing. Patient is taking medicines
Hmm.
almost 8 to 10 days prior. So those who are in the final stage,
Yeah.
we can do it, but then newer ones we are not doing.
Okay. Interesting. So, is there any suggestion that you have for women to build their immunity? I know I did mention, is there a magic potion? And I'm sure there is no magic potion as such. But maybe Dr. Kalpa, as a holistic healer, or as somebody who follows the Garbha Sanskara theory of pregnancy, maybe you can shed some light on this. Do you think, is there anything that women can do to build up on their immunity during such a time?
So basically, it's not that maybe they'll get corona, but if they get other infections, maybe corona will slide in with their immunity, which is low. So simple things like having boiled
Yes.
water, having food which is prepared at home, which is hot, which is cooked on gas, not having fruits which is like uncooked or something. So everything that goes in the woman's stomach should go via gas. So either it is heated or it's cooked and it's eaten by the pregnant women, preferring simple foods, avoiding non vegetarian foods. So, these are simple things that a mother can do just to avoid any infections, not just corona. Simple. So, maybe you may not get corona, but if you have got some other infection, you're opening the chances for other infections to glide in because your immunity is low right now. So, basically, taking care of the food and the water that they take is good enough. Washing hands before cooking food, washing hands before eating, these things will be quite helpful.
Okay. We have a
Just
question
want
from
to add,
somebody who. Yes, 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 Dr. Shilpa.
Yeah, just wanted to add because in the groups you get many circulated messages that you drink boiled water with turmeric, with pepper, and all those things. So just remember, all these means they are not harmful, but then you don't have a false sense of security that you do that and you'll be immune. So whatever done and said, taking proper safety measures
It's
will
necessary.
only contain the disease.
True, true. That's the problem is that what I have understood about human psychology is the more you're educated, the more you in panic situations like this you want to try anything and everything that people suggest to you. So
So
yes,
you
we
may
have a
try,
Facebook
but
asking
like
us
Dr. Shilpa
what is
rightly
the best
said,
diet to
you
be
may
taken
try,
at
but that
home
doesn't
in
mean that you can be out.
yes, yes,
I was just saying, like Dr. Shilpa rightly pointed, see, you may try everything and anything that has been suggested to you, but that doesn't make you bold enough to, like, now I've taken everything. अब मैं किसी भी चीज का सामना
Immune.
कर सकती हूँ. So, I mean,
Bahubali
okay.
let,
again.
yeah. So let's not get into that phase. You may try and still continue being safe.
True, true. Very good. So yes, so like this user is asking us, what is the post delivery care to be taken at home in ongoing situation other than no announcement? So ठीक है बच्चा हो गया नहीं किया. What else do we need to keep in mind?
So,
Dr. Shilpa, you tell
yeah,
us.
okay. So, the routine care which you were taking previously to avoid infection to yourself, same way you have to, again, social distancing is the thing. And of course, handling of the baby only by you or your immediate caretaker. Preferably, I would say maybe you can restrict if the even the father if he's going for work and those things because a newborn is still very vulnerable. So for some time,
True.
maybe keeping that also to a minimum, only when he's at if the husband is at home and uh, uh, has absolutely had no contact with him during that phase, maybe he can handle. But yes, the distancing part has to be taken care. Whatever food you give, and of course, in the newborn, it will be only breast milk, but later on whatever additional things which you use, supposing you're using an apple card or whatever, so those also where you're keeping and how general hygiene which should be followed as such, or vati spoon if you're using for the child, then whatever hygiene measures have to be taken care which are a norm, boiling those things, and the same thing has to be followed. So, and
Okay.
only the amount of people who are coming in contact, that is one more point which you can take care.
Dr. Kalpa,
To
taking that
add one more
discussion
thing,
from there, before you add, I want to ask you something. Now, what happens if this is the second child in the family? So you have an older sibling who's overly excited and wants to keep touching the baby, wants to keep kissing the baby. How do you explain to the child, or what do you do to keep the child away? Tough
yeah. So
question, but yes, has
correct,
to be
correct. No, so
answered.
I was just adding one more thing. We Indians have a tendency to kiss the child. So I was just adding to what Dr. Shilpa said,
Yes,
avoid kissing the child unnecessarily. So basically, you need to talk to the elder sibling and tell them, or it's not just for the younger sibling is more vulnerable, he is also equally vulnerable. So when he feels I also need to be equally protected, he will consider that the younger sibling also. When you say younger sibling needs to be protected, उसको ऐसा मत करो, तो that elder sibling might not feel correct. So उसको बोलो सब जन को protect होना है ये
yes,
virus से. Simple thing you explain him कि everybody needs to clean the hands, everybody needs to clean the hands before touching each other, because this is a small baby, he cannot clean his hands every time. So we need to be little more careful while we are touching the baby. And basically, if you get him to into the part of, so we can give him assign some roles, like you get clothes for the baby. This is in a way in which you can show love to the baby. You can maybe just झूले में बच्चे को डाला है तो तू झूला डाल दे. There are, you can play with some toy from far with the kid. So we can engage him into small responsibilities, small activities, and give him small responsibility. So that small responsibilities, he'll feel like, oh, I'm in the you give him, like, when everybody comes home, you take care कि वो हाथ धो के बच्चे को हाथ लगाए. So now he's forgotten that he's supposed to touch the child. He's going to remember कि अरे जो आया है उसको हाथ धो के बच्चे को हाथ लगाना है. So while instructions that you want to give him,
True.
no, you make him give the family members.
Mm.
तो कोई भी आएगा ना तो उनको बोलना कि बच्चे को किस ना करे. So it will go via his mind. Oh, when others can't, can I? So when it is directed towards the elder child, it might probably not be taken correctly. But when you give the elder child the responsibility of taking care of the younger child, he will make sure he also doesn't make the mistakes.
True, that's very interesting, and yes, that can be done. Another thing that I wanted to ask is, so which means we basically eliminate the need for a malish wali also, because we Indians have the tendency to fix a malish wali, and she's going to come and generally squeeze the life out of the baby. But I think in such a situation, we have to avoid a malish wali both for the baby and for the mother. I'm right, I guess. You're both nodding.
Absolutely, absolutely, you have to avoid. The best possible malish is given by mother herself, and just lightly she can caress the baby, and there is no additional benefit with by squeezing the child in whatever way can be done. And of course, we totally advise against instilling some oil into the nose or ears or whatever. So that's
Mm.
totally not advisable. So we are not missing anything if the malish wali is not.
Okay. Now, the next big thing that has been running in my mind ever since we have started with, this, the rumor mongers and all of that. Now, everybody who's anybody is using a hand sanitizer now. Now, the higher the alcohol content, the more safer people feel. But isn't, too much of this sanitizer also not too good for a pregnant lady specifically? Because I don't know, the alcohol content, the fumes itself hit you directly. So, what do you recommend? What do you say, Dr. Shilpa?
I
Is
would
too much
say
is hand sanitizer good?
it is not the part of being good or bad, but it should be used when necessary. So there is no substitute to hand washing, first of all. See, we must remember that what sanitizer does, that alcohol does, is it will superficially kill the virus or bacteria or whatever, but it is not going to remove the dirt. Dirt is only going to be eradicated by using a soapy solution which will reduce the surface tension. So if your hands are dirty, then they are going to, the particles are going to adhere, the bacteria, virus are going to adhere to it. So that's not using just a sanitizer every now and then is not a substitute. You have to wash your hands clean, and at places wherein you require this more frequent, that is at certain times, at that time you can use the sanitizer. Routinely, there is no need to keep on using the sanitizer at home when you're at home. And regarding how much you
Okay.
should use, whether it is 1 spoon, 2 spoon, there is no study on it. But I would say yes, it should not be a routine thing to be used every few minutes or every in the throughout the day. So you have to use it with caution only when needed, and especially I would say only if you're going out and you need to use it. You don't have a facility to wash and do that.
Okay. Dr. Kalpa?
Just reaffirming, hand sanitizer is not a substitute to washing hands. You need to wash hands, and if there is no source of water or soap, you sanitize them.
Okay. Um, what else, Dr. Shilpa? Is there anything else that you would like to add? Because I've kind of exhausted all the questions that were running in my head. Is there anything? Is there anything else? Would you want to, advise our women and reassure them?
Mm.
Uh,
What I want to say is that this viral pandemic is just a phase. So, it is going to go. It is going to go in what 2 weeks or 4 weeks or 6 weeks. We don't know the date when it is going to go, but it is going to go for sure. Now, how much is this going to affect us and to the people around us or to the world? That we are not sure. So when we are not sure, there is no point on just discussing on that. So what needs to be done means the action which needs to be taken is that the norms which you should follow, the measures which you should take to prevent its spread. So rather than getting confused and getting anxious about नहीं क्या होने वाला है, क्या होने वाला है, क्या मेरा क्या होने वाला है, मेरे बच्चे का क्या होने वाला है, instead of thinking of all these things, if you are can think that no, it is a time phase and this infection will go like any other, which is for sure. That means you have to reaffirm that to yourself, so you know that this is not going to be a lifelong thing. And secondly, what action you should do and what you have in your hand to curtail this, so those steps you should follow. So I think if that is done, then we can just be cool about this infection and just wait for it to go. Take care of yourselves. No need to be panic and no need to get anxious and remain worried all the time. Enjoy your pregnancy. So I think that's what
So
I
I would
would
like
like
to
to add.
just add in the what Dr. Shilpa just said. Let this not take too much of space in your mind. Don't be scared about or don't be feared about this disease. Don't let it affect your mental peace, especially in these pregnant times. So be careful and enjoy the pregnancy. All right. So I think Vandana has, due to the network issue, I think she's left the meet. So thank you very much, Dr. Shilpa and me.
Thank
Both of
you.
us are available on this video. Also, you can put in your questions and comments whenever you see them, and we'll be there to answer that. Thank you so much, everybody. I thank you, everybody, on the behalf of Lajja also for attending this show. I thank Dr. Shilpa to contribute so much in terms of
Thank
sharing all
you.
the messages for the pregnant women. Thank you so much, Dr. Shilpa. It was
Thank
pleasure
you.
having you here.
Thank you, Dr. Kalpa. Thank you, Vandana.